Just link it. Link it. Pradeep.
Okay. Guys, can I have a secret? Very simple. Sir? Going live? Where is my wife?
5 minutes over. Full screen. Full screen.
Yeah. I had unmute for a moment.
Cube. Voice. Pick. What is the point? What does he want to measure? Does it? Yes. Pin.
Or a slideshow. Not happening.
Hi, good afternoon. With the continuation of the online series, when an ad came out and she asked me, you like to do something? That same day I had interaction with our interns, and then I was wondering, and there's something very close to me, and I thought, okay, let's do empathy. So, it's okay, you can go ahead and do empathy, and then it was the simulation environment which was being involved. So I was wondering. So I thought, okay, I'll keep myself and go by empathy by Senapathi. So when I was preparing for the talk, I thought the best way would to relate myself to what I'm used to, and that is the football. So all of you know this guy. Many of you know this guy, Christian Eriksen. In the ongoing Euro, in the match in Denmark and Finland, exactly 2 Saturdays back, he just fell unconscious on the field, on the pitch. He almost dropped dead. So what happened? After that? After that, he was revived by 2 paramedics. Great. But then what I really liked was the captain of the Danish football team, Simon here. He came out and he brought out some qualities. He was swift. He did the initial CPR. He brought his team together. He held their nerve. At the same time, he went on to see his Christian Eriksen's wife. He empathized with her. He got the feelings, right? He got the whole team. He got the feelings surrounding. And in fact, if you can see the picture, they have a piece of cloth around. And the piece of cloth is in fact the Finnish flag over there. So whatever resources were there, he pulled in. These are the kind of qualities I want my young healthcare practitioner to develop. And that is why I thought, okay, probably this would be the way to start empathy by Senapathi. But then came the advertisement from a college, and it said order. It's empathy in simulation. Okay, and I was wondering, alright, so we got to bring in aspects of medical education. We got to bring in aspects of AIMCOM because AIMCOM and So because AIMCOM and the present competency-based medical education, a lot of these competencies, a lot of the roles, it has empathy mentioned everywhere in this document. So this is a document young doctors should be reading. Young doctors should be, abreast with. And everywhere you see, there is empathy written, and empathy is there everywhere. So we got to know what empathy is. So empathy in simulation is what the college told me to do. And then I was thinking, all right, so empathy in simulation, how to bring the elements of simulation into something like empathy, and then okay, empathy and simulation. So right, so basically the objective of the talk is first we have to initiate teaching empathy in this simulation environment. We got to go to the environment in our institution, and we got to maximize this environment to teach empathy for our young healthcare professionals. And for a younger lot, unraveling empathy as a key tool in the making of a social health care practitioner, a social physician. So how empathy plays a role and how it has to be brought to the fore for these youngsters is the very main objective of today's talk. And for all the experienced doctors out there, experienced healthcare professionals out there, I thought that if we could expose the various ideas which are possible in the simulation space to sharpen the empathy quotient. It is there. We just need to sharpen them in the simulation space, for them to be a lifelong learner. So that is one main objective as well. So these are my three objectives. I told you simulation. What is this simulation? This is a simulator. As you can see, this is a simulator of the Boeing A320. And what are they even trying to do in a simulator, in a simulation environment? Simply put, they're just imitating a real life experience. So you wouldn't want to fly an aircraft without really learning how to do it. And at the same time, the dangers which are posed with flying an aircraft, the various situations a pilot has got to handle whenever an aircraft is being flown. And these are the ones what a pilot goes through when he's on a simulator. Similarly, we doctors and we other healthcare professionals, we also should be going through simulated experiences, because these simulated experiences would just add great value to our learning process. So what really makes a social physician? That was a main objective. My second objective, that the entire idea behind why we're doing all this is we want every youngster to be a social physician. You got elements of knowledge, very importantly, absolutely good in communication, understanding the social context, the culture, the cultural identity of the people they're looking at, the geography, very, very important, economy, law, value system, imbibing them, hard work, talent, and discipline, and stuff like that. But then one thing what we really miss out on today's age, which probably was something right up there with the physicians of the yesteryears, is the component of soft skills. So I have an image of probably a wonderful social physician here, and she's Dr. Nisha Pillai, and she happens to be actually the mother of the person who did this PowerPoint presentation for me, my friend Parvati Pillai. Yeah. So soft skills. So soft skills is the game. We try our best to observe and learn soft skills, to look around and learn soft skills. We always have this ideal kind of a physician in mind, and ideal teacher whom we look up to, and stuff we want to imbibe from them. And they are nothing but communication and inquisitiveness, which is very important. This creativity and being assertive, very importantly, team spirit and all this. But something very central in the soft skill space is the empathy quotient. So empathy is very central to the soft skill space, and this has to be, in a way, learned. And the best way probably we could learn it and we could sharpen it is in the simulation space. And we are very fortunate that we have something like that in our institution. Yeah. So empathy everywhere. What is the feeling, or what is that you can draw by looking at this elderly woman. She's got a story. She's lived her life. Every wrinkle out there has probably a story to tell. How are we even supposed to know that? How do we have the skill to understand this? How do we even learn this? There's this elderly gentleman. Look at his eyes. There is so much he wants to express. There's so much he's expressing. Are you able to identify with it? Are you able to understand it? Are you able to even relate to it? There's not much time to get this feeling and this understanding by probably one go. But then as you keep looking at that, we got to learn a lot, right? So what is this empathy? So empathy is basically, we are trying to understand, importantly, and feel what another person is experiencing, but importantly, from their from their frame of reference. So that's very important. We should have the capacity to position oneself in another's position. So how do we position them? Very easily and very often used quote is empathy is putting oneself in another person's shoes. But how does the shoe even fit? How is the shoe? Is this an swanky new Adidas shoe or an old tattered footwear that the person is trudging along with? So it is for us to understand that, and we need to modify ourselves and change ourselves and put ourselves in that shoe. So understanding the shoe itself is very important. So there is this desire to help people, and that has to be an innate desire which comes from inside. And probably that is why we are all here. We are here at the end of the day to help somebody, right? Yeah. And experiencing the emotions that match another person's emotions. So it's all about feelings and emotions. Importantly, the gulf what we have between us and the other person, the distance what we have between us and the other person, if we could pull the distance closer, if we can make the difference less distinct between the self and the other, that is what empathy is all about. So we got to really put ourselves in another person's shoes. So easier said than done. Initially, it might be something very difficult or very awkward. It might take some time. But then when it becomes a process, when it's practiced over time, when we understand that, there is a perspective to what another person is thinking, and we kind of unravel that perspective, kind of understand this perspective, take time off and make this as a practice, that is when we actually become an empath. Yeah, so what's the need? Why do we need to do all this? Wasn't this practiced since time immemorial? Don't doctors know this? Don't other healthcare practitioners know this? Yes, they do. They do know it. But then what's happened is, what has been put forward in studies as well, research tells us that, over a period of time, especially with clinical exposure and this being the norm and routine, there is a decline as far as the empathy quotient is concerned. I know we are exposed to different situations, we have different learnings and all that, but yet research has shown, especially of late, that through the clinical years, there has been a decline, a steady decline when it comes to the empathy quotient. A doctor has his own vulnerabilities, a nurse has her own vulnerabilities, a physiotherapist, a dentist have their own vulnerabilities and hazards. And when this is there playing in the back of their minds, we probably would not be really in that space connecting with the other person. So skills to sharpen this are very important. Idealistic role of a doctor. So the society always expects and sees a doctor as an ideal person. So there's always this expectation where you got to scale up to the level of what is expected, and this pressure is always there. This pressure to perform is always there, and this pressure to be steady and straight and composed and comfortable all the time is always there. But then, can we do it all the time? Is it possible all the time? And how do we train ourselves to be there all the time in that kind of a space? So, expecting this idealistic role of a doctor also makes us, important that empathy is taught in practice. Increase distress. We have all sorts of, distortions and disturbances, especially of late and this in the digital era. So increased distress is another very important need to understand and learn empathy and practice empathy. Of late, we all know that there are conflicts in the healthcare scenario. We've all been a witness to rising conflicts in the healthcare scenario. At the same time, we would have probably been on the receiving end of conflicts in the healthcare scenario. So when this happens, we probably have to kind of introspect and see as to what is that little thing where we could be a little different. Yes, there's a lot which needs to be done on the outside world, without a doubt. But then what is this little thing or this little change which could come from within or which would come from our side? And that probably could be some relevance to do with empathy. So right from a first kind of a meet with our client or our patient, and through the journey, and when we wave them goodbye, empathy and the qualities have to be displayed. And for this, we need the training. So training, empathy, initially empathy and simulation, it all sounded very counterintuitive. You're talking about humans, you're talking about feelings, you're talking about emotions and whatnot. But at the same time, you want pieces of plastic to to teach you this, and this sounds very counterintuitive. And initially, I also thought that would be the case, and I kind of learned my stuff by looking at my seniors. I kind of learned my stuff from working with my patients and with the community, and that's where I got it, and that's what I thought. And how could the simulation environment probably bring that? And that's when I understood that there are arguments on both sides. There are people who say that this is there. It's just a game, and it's called the simulation game. So the argument is, if we expose our students and healthcare practitioners to a simulation environment, and they get to play the game, they get to play the game every time they see patients, and then it's not being true or it's not being themselves all the time. So that's the argument. But then research studies have shown over a period of time that no, simulation has got a role as far as effective education on empathy is concerned, and at the same time, there is a definitive improvement in the quality of the healthcare practitioner whenever they're delivering. So, to lay the doubts aside, let's bring in the simulation environment to teach and practice and sharpen empathy. Yeah, so how do you incorporate empathy in the healthcare teaching? How do you bring these elements through the simulation environment? So the best thing probably would be a high fidelity mannequin or a mannequin, however you want to call that. So you can see that image, and there is this high fidelity mannequin. Initially, when you see it, might probably look like a lifeless person lying out there. But then when you start developing a relationship with this mannequin, when you tend to kind of get the feeling as to this person is actually bleeding and is going through hurt and pain, and they got to be something done enough to ensure that this person is all right or okay. And when this attitude and the thinking starts, that's kind of the first step towards developing qualities of empathy. And youngsters, when they're exposed to this kind of a situation beforehand itself, when they really face it in the real world, they know to act as to what they really need to do there, and in what space of mind they got to be when they are doing the act. So high fidelity mannequins. There we have about 7 to 8 high fidelity mannequins in our skill and simulation center as well, and these will be used teach you all qualities of empathy. Standardized patients. So what happens is we could have standardized patients, simulated patients. We could have actors coming in and simulating scenarios. And then when these people act out and when these people come out with their act, our learner is able to see, is able to look at it and learn from it. So standardized patients is an option. Role play. So we can have role play going on as an option, and it'll come there. Watch. Also, this virtual reality is something very new and something exciting. So what happens is you might be doing the Google goggles and all that. So you wear that and you can feel as to what the other person is doing. I'll give you an example later. Videos can be played and empathy can be shown in the form of videos. We have task trainers in our skill lab as well. For IV punctures, for delivery, and all these things. And these task trainers are also important. Mock environments, all of you know that. So all this is there. So we concentrate on two aspects of empathy, and one is your emotional empathy, and the second part is your cognitive empathy. And these are nothing but two sides of the same coin, and we need to know both of them. So what is this emotional empathy? So emotional empathy has got to do with your feelings, something what you've already been there and seen that, something like akin to a child cutting a cake, and when you go and you've also cut, you've had a cake cutting experiences, and how exciting it is for a child, how it feels like for the child. So you get into the feeling, you get into the space, and so this is what emotional empathy is all about. So let's have a quick demo on emotional empathy. So what I'm going to do here is, there are my young doctors here, and I want them to teach and learn emotional empathy. So they're going to look into the eyes of each other for some time. And they're going to see and look into the eyes of each other and go through the experiences, the feelings what they're getting in their space. They're looking at each other. And there are all sorts of thoughts which are running into each other. We'll give them some time. There's intense concentration. There's something being spoken between each other. Thank you. Yeah. So, a very simple demonstration, a simple act what we could do. Easily said, but when we do it, there are a whole lot of emotions running in. Probably it even started with competition, and then it mellowed down, eased down, and then there was this feeling of getting easy, getting to know the other person, and slowly you tend to get in the shoes of the other person. Probably like that person, and then you genuinely love that person. So all this is a possibility. We did this in fact a couple of days back. We did this exercise. And just listening to what my young doctor has to say after we did it. Yeah. So this is Pratika.
I think initially we both, like when I was smiling, I didn't want to talk. But then I'm looking at it, I wanted to open up. I started getting some things. And then I just saw that she opened up, we both got very emotional. It felt like a therapy session. It's very soothing, it's very comforting. And even though I know how to be there or how to it was very nice.
So what happened is we had the demo, and then in their own quiet voices, they started talking to each other. They didn't know each other before, my intern and my postgraduate very well. But then this is the connect they got after a couple of minutes. So wonderful. Yeah. So that's your affective empathy. So you get the feelings part. So what is this cognitive empathy? You know, the image is there. You know, it's all gaji inside somebody's head, and you want to get there. You want to understand the perspective. So this is all about understanding perspective. So the first part is about getting the feeling right. The second part is about getting the perspective right. You got to understand the perspective of what they're thinking, and effectively communicate this perspective to the other person. So this also is an important component of cognitive empathy. And this cognitive empathy is actually known as the hard empathy. It's a soft skill, but it's called the hard empathy. And to do this, we have some empathy building tools. That was a very simple demo. We have some things which are new and something like Jim, the empathy simulator, and he's nothing but an Australian man in his 70s who's having dementia. So you have, this was developed at the University of Curtin, and you have the students talking to Jim, sharing the views with Jim, and understanding what Jim is going through, and Jim himself evaluates as to how the student is or was. We also have suits. There's a suit named Agnes. So you have a neck collar which limits the mobility. You have the earplugs which limits the hearing. So this is what an aged person undergoes. You have this guy, so there's no flexion. There's gloves, so you really can't touch and feel. Helmets and goggles to mimic a cataract, and you have these bungee cords where you can't move. You have a belt which ensures that the person cannot really move, and you have some elastic bands. You know what happens is this person is all tight and hard, and he knows what it is for a geriatric patient, what it is for somebody with arthritis, what it is for somebody when they're getting old. Youngsters get a feel of this, and this is what suits do. You have something like a hand mop or a miniature grasp. So for pediatricians and periodontists and pediatric therapists, they really get to understand what it is for a child to grasp, because they're given this grasp and they get to know the dimensions, the maneuverability, the flexibility, and in fact how much the reach is, and all this can be taught with the hand off. You have an age simulation suit as well, something like what we saw earlier, and this has weights added to it, and it has goggles, and through the goggles you can actually see for the loss of visual function and how vision is, with the walking stick and with all the weights. So there is the simulation where you can get into the feet of an old person and know what it is and how it feels like to be one in your young age as well. Yeah, and there are other empathy building tools as well. I was interested to know that the MIT's virtual human interaction lab, we got the Palestinians and Jews, the Israelis go against each other, and MIT built a tool where there's a virtual peacemaker. This guy called Jamal is there, and then you got the Jews, and you got Jamal talking to the Jews, and they get to understand each other's perspective. They get to communicate each other's perspective, and there's this virtual peacemaker. Alfred is there, and Alfred wears his goggles. You get that, and this is for macular degeneration, probably useful to ophthalmologists and optometrists. So you get to wear it and you get to know what it is for a person with macular degeneration to go through his everyday life. Where the field of vision is blocked, what do they really get to see, and when you get to understand this, your quality you deliver is going to be much better. The Dept Empathy Lab, deals with disabilities. It's wheelchair bound, or you have any other disabilities. You learn that virtual disasters. How do you manage disasters? You go through a virtual disaster scenario. How do you really look at it? Those things are there. Stanford's virtual human interaction lab is wonderful. And most importantly, we got all this high fun stuff, but we got simple stuff like communication and physical training. So how we improve the elements of communication, how we use the elements of communication, good effective communication, and deploy that in a simulation environment. Pulls and pushes our empathy quotient up. So all these empathy building tools are very essential as far as affective, and importantly, the cognitive empathy element is important, because that is where we kind of understand the perspective and try and communicate the perspective. It's important. Yeah. So just a word on simulation for compassionate geriatric and end of life care. We sort of saw that death and dying is very difficult. Communicating that and being a part of the process is not something what is comfortable. But then when we learn this in a simulation environment, we'll be able to handle it when we are actually faced with it. When we are actually facing our patients with it. So we got to provide a safe environment and this attitudes and it improves our communication. Most of the times we go numb, we don't know what to say. But then we got to say, because we are the ones who got to say. Involves our critical thinking as well. So for this, what we do is we could have swapping of roles. The swapping. So you have a healthcare practitioner, and they are the simulated patient who's probably dying. So the healthcare practitioner, the doctor, is communicating with the simulated patient. The simulated patient is simulating and showing them what it is to die, and so this gets to feel and understands the perspective. And then what happens is you swap roles. So what happens is the healthcare practitioner now becomes the simulated patient, and now this person has got to enact the process of probably dying or what it is to die and how the feeling is. So when you are in the shoes of the simulated patient when it comes to death and dying, you get to understand and know what it is. So the next time you deal with a scenario like this, you are well equipped and you know what you're doing. Yeah. So this is as far as the geriatric and end of life care is concerned. So something very central to empathy, something very central to what we all talk is the listening part. And I'm happy that you're all listening to me, so thank you very much for that. But then the art of active listening is something we all got to imbibe. We know through our day, through our experiences, we are colored by what we hear. We have a prejudice. We are preset. Okay, this is what the person is telling you. Your patient is telling you something. You want to hear that. You are hearing that. But somewhere there is this element where you are colored by what's happening, probably by previous day, what's happening at home, whatever it is. You got some little element of prejudice sometimes. So this really does not allow us to listen to what the person is telling, to understand the perspective of the person. So we got to be completely blank and completely out there, completely with them and through them as they are talking to us. So how do we do this? This is a skill. This does not dawn upon us suddenly. And for this also could be done as a part of a demo. So we just show you how that demo works. We have two young doctors here, and in the demo, they are connected to each other. They have their eye contact maintained. But then the beautiful thing is, only one person talks, and the other person simply just listens. Without nudging, without telling them anything, without responding, plainly listens, without any prejudice, without any assumptions, just completely hearing out the other person, allowing the other person to express and to tell as much as they would want to, whatever they want to. We have time for all this. We think we don't have time. We have all the time in the world for all this with every patient. So the other person is just listening, and this person is talking. Thank you. So what this builds is, after listening out and hearing out the person completely, is a very respectful and a very compassionate relationship. And this demo can be done two ways. So you got one person talking, another person listening, and after a period of time, you got this person talking and the other person listening. So we could do that, and we did that. We did that with our interns, and what happened was my intern Ramnath, he actually had to go down and see a patient immediately after doing this. So we know that he's a very shy guy and who doesn't really open up and talks. But this time around, we had something different, and this is what he had to tell. This is after the act. He went and saw the patient, and this was his feedback, and this is live.
So you have to understand that most of the times when you give the ear, you would be the vent for that person. For all you know, this old lady who came does not have somebody whom she could vent out to. Yeah. This just happened now. Just happened now. So this is just after exercise. See how small exercises like this simulation, what we do, kind of helps. So that's why, in spite of us thinking that we know certain things, there is always scope for learning, and we have to implement that learning in our everyday life when it comes to patients. The classical example being this: you just made a day, man. You just made a day. She told you all the difficulties. She just poured out, and then probably she walks back as a much lighter person. So what happens to the disease process? What she's come to? Also, along with the treatment, when you do something like this, the person is more hale and hearty, right? Okay, good job.
Yeah, so he got to hear out an old lady, and she just poured herself out. And this is what I wanted the patient to undergo. This is what I wanted my young doctor to undergo, something very true and real. So the concept of empathy and the training of empathy, we need to make this environment conducive in the training of empathy. So we need to do a pre-briefing, get into the space, get our learners to the space, where they understand very clearly what we're trying to do, and then we conduct the demo. And post-demo, always debriefing is very essential because they need to understand what is that they've done, what is that they've undergone, what is that they've learned from the entire process. And after that, you have the emotions and reflections and narrations like what happened. And in the process, there's going to be this positive social change. Finally, coming to the advantages from this novel learning method, brings in a very high degree of diagnostic accuracy. We know very clearly what the pharmacological and psychological interventions we're doing. Importantly, the patient enablement, because the patient knows what is happening, what is going through, and what is being done to them, and what they can expect. So invariably, this leads to better health outcomes and better prognosis. And we all work in a team, so we train to work in a team and live with the team. So better team building environment kind of blurs the lines of hierarchy which are there, and yet keep it very professional. These are the advantages. The ultimate benefactor at the end of the day being your client, being your patient whom you work with. And to measure this, we have all scales like Jefferson scale and other questionnaires and all that. So in this online dunia, what we are in, how do we really maximize this is we are conducting these online cases and online discussions. We have the opportunity to actually bring in videos, bring in simulated patients. Simulated patients can be your postgraduate, can be yourself, can be a colleague, can be somebody else in the college. You can use the simulators, mannequins, and task trainers. They're all there. Use them. At the same time, disinfection and sanitation is actually easier with this rather than bringing in the live patients. You can conduct studies on empathy where you can look into simulated patients versus mannequins and things like that. So ultimately, the benefactor being your patient. Yeah. So in a gist, this is all I wanted to say in today's class. It's a beautiful video. Have a look at it. Three minutes of beauty. Fear. Hope. responsibility. Money. Relief. Distance. Tiredness. Hope. Life. Dread. Struggle. Small victories, major losses. And you. This kind of summed up whatever I wanted to tell. Empathy is uncomfortable. You got to predict the past and remember the future. Now, we always say we remember the past and predict the future, but here you got to predict the past and remember the future. Practice hard empathy. Every person you're dealing with has a family, has a life they've lived. They run through a lot. Know their story. Yeah, I thank my seniors, starting from the management to the dean, to my HOD, and most importantly, my wonderful Dr. Sharath and Dr. Sushit have helped me a lot in this presentation. My mates, my buddies who have been there throughout, and got very special acknowledgement to my juniors, my young docs, my interns from Pane and Kaur and just everywhere. You know, they are here. So thank you guys. So thank my juniors as well, and thank you all for joining in for today's talk. Thank you. You got any questions? Let's talk. I'm in this whole feeling space. So, got any questions you can talk, or
No questions.
let's say all of you can have a very mellow down, soft weekend. The times are there. Thank you very much. Thank you. Thank you, guys. Like a new show.